You're tuned into RikClassic 88.2, and I'm very pleased to welcome my special guest today, the eminent psychiatrist and owner of the Transcranial Magnetic Therapy Center, RTMS, Dr. George Mikellides. Welcome to the program. So nice to see you again.
Thank you, Saskia, for inviting me here today.
Yesterday was the International Day for the Elimination of Sexual Violence in Conflict. And Antonio Guterres, the UN Secretary General, said, and I quote, "Children conceived through wartime rape often struggle with issues of identity and belonging for decades after the guns have fallen silent. Their mothers may be marginalized and shunned by their own families and communities. This day is set to amplify their voices. Those forgotten victims of war who suffer stigma, shame and exclusion in societies polarized by armed conflict." The words of the UN Secretary General Antonio Guterres. So, Dr. Mikellides, a very serious and difficult discussion, I think, to admit that even Cyprus can show how true that statement is. That goes back to 1974, where the emotions still run very deep. Do we have cases that you're aware of children born from the war? Is there this research and data available?
So in terms of research done in children born in 1974, I'm not aware of any specific research done in children from that era. But what I'm aware of is that we're facing today as well in Cyprus hundreds, actually 1,680 cases last year of domestic violence, and which children are also the victims. 172 victims were last year were underage, or under 18 basically. So we're aware of loads of cases in Cyprus as well, being emotionally, physically, sexually abused, neglect, which is also a huge factor in terms of abuse, and we should never forget neglect, which is also violence towards children, to neglect them and not provide the basics for them. And how is that actually related to loads of physical and mental illnesses as well? And think of post-traumatic stress disorder, which we do see patients in the clinics of patients being tortured during 1974 as well, and also being victims of abuse when they were taken away to Turkey in that time as well, and being abused in Turkey's jails and concentration camps as well.
How does one actually start to deal with that, and how much after 1974 did people actually have help? Is it men and women?
Yeah,
it's the children who were born.
Majority are women being abused in times of war, and children as well, but also used as a tactic of war, abusing sexually, physically and emotionally men in terms of degrading and humiliating them from the rest of the society, and marginalizing them, as well as isolating them and stigmatizing them by the society. So I think what's important to see here as well is that even our own society stigmatizes and marginalizes these people and considers them as outcasts from the society. And even having families or bringing up children themselves, it's a struggle, and it's very hard when you actually had traumas yourself, and it's a difficult task, especially when the society itself does not help you with this.
This was very prevalent also in Yugoslavia, of course, where in many cultures, if a baby's biological father is the enemy, it tears the entire community apart. So I'm thinking particularly as I said, in Yugoslavia, of this ethnic cleansing. How do women need to be supported during and after a conflict like this?
There is a lot of need here, and unfortunately we need to start from the social norms. I think the social norms needs to change. The stereotypes and the prejudice that exist in our societies about people being abused in general, it's huge. We need to start thinking, how are we going to change the way we think about these people being abused and not to be the outcast of the society. They need a lot of psychological support. They need a lot of financial support. They need a shelter, a place to be protected. Even their own families, they might kill them as well. So especially in places like when we see the Islam being a factor of thinking that your daughter has been raped and the only way to honor your family is to kill your own child. Sometimes when we hear about these different things, and you mentioned Yugoslavia, and in the last year's Secretary of the United Nations, it was mentioned Bosnia-Herzegovina, and how so many decades pass by and the problems are still there. People are still suffering from Ptsd, from post-traumatic stress disorder, and there is a lot to be done. And unfortunately, societies and perhaps the resources and the financial cause stops people from being actually given the help they need.
The stigma, though, it seems to be the first thing. And this is only if somebody actually comes out and says and actually admits. What kind of courage does it take? We're seeing, especially now with the Me Too campaign, that more people have had the courage, but they've been persecuted.
I think a lot of people decide to try and hide that away from everyone, including families, including your siblings, friends. You think that if you actually come out and talk about it, you will be stigmatized and your life is going to be much worse.
Yes.
Which it does happen a lot, especially when our societies are the way they are today. So you will be marginalized and you will be the outcast of the society if you talked about being raped. You might think that if I talk about my rape, then perhaps I will never find a partner. No one would like to be with me.
Yes.
I'm a victim of rape. Who would like to be with me? Who would like to raise a child with me? And this is the real life scenario that people are thinking perhaps they would be better off to hide that away from everyone. Obviously, in that way, they might never get the help they need.
There must also be a certain amount of guilt that needs to be overcome, also coming as part of a stigma from society, saying, well, you asked for it, you were provocative. Is there ever any circumstances where one can say that that would be acceptable?
Of course not. If someone says that, then I think it's unethical, it's not moral, and it's probably a misogyn or perhaps someone who is presenting with some hatred towards women, or in a way that people are trying to present with a mentality that is far beyond our times, far away from 2018. It's a way of controlling. It's a way of controlling, and we can see still today in many countries around the world that men want to suppress women. Men want to control women in many different ways, through religion, through culture. But I think in a European country today, in a country we all live in, Cyprus, perhaps we need to try and address the recently signed, for example, Constantinopolis Convention, which has been signed by many different countries to protect the women's rights, basically.
Tell us a little more about that.
So it's basically written, it's now a law that has been passed by in Cyprus as well. We need to think about how women can be protected in different ways. For example, until recently, stalking, a behavior that was basically harassment towards women. There was no particular law in Cyprus to address this, and women were trying to get some help from the police in the last decades or so in Cyprus. And someone, for example, could call them up, or just hiding away from their own house and spying on them and try to see what they're doing and stuff like this. And until recently, there was no law enforcement to be able to take that to court, and they could be advised by the police, just there are no charges we can bring. We can call this person up and say, please stop doing that. But now it's a criminal offense, and stalking, it's something that women can address and get the help from the police.
Have there been any cases which have gone to court and which have resulted in a sentence?
From as far as I know until today, no, because it's been only recently in the last 1 or 2 years in Cyprus. Has been,
in 2 years, we haven't managed to prosecute one case.
That's what I think, yeah.
So that says it too. The court system needs to be put into place much faster. And speaking of the legal ramifications as well, how au fait are the police, and how much training have they had with regard to dealing with somebody who's been traumatized by rape? Do you, as a psychiatrist, get called and asked to assist in those crucial, it must be those first hours, must be extremely crucial, or am I mistaken? It's the follow-up that's more important.
It's the follow-up that is very important. When we think about PTSD, majority of people after, for example, a trauma, they will have symptoms of PTSD within 2 weeks. Most of these will subside, and then we will not be talking about PTSD. We'll be talking about a traumatized event which had some PTSD-like symptoms which subsided. What's important is
do you want to just go into a little clarification of PTSD for those who might not know the symptoms?
PTSD refers to post-traumatic stress disorder. There are some guidelines which recommend maybe perhaps after an incident of trauma, a watchful waiting over a period of a month will be helpful. So watchful waiting is not like we start giving medications straight away. Sometimes medications like benzodiazepines can calm the person down if they're in a form of hysteria, let's say.
Yes.
But the person needs to go through the trauma and process the trauma. We don't want the event to be kind of like hidden away, because like a snake will come back and bite us. So we need to try and address it the correct way. So let's talk about some of the symptoms of PTSD, as you mentioned, Saskia. One of the symptoms is like hyper-vigilance. It's a difficult English word. I don't know if many people know this word.
Yes.
It's like constantly looking for a danger.
Yes.
So it's like you're alert, and like you might feel like someone is behind you. So you turn your head left, you tilt your head left and right to try and look for what's happening. You might be very oversensitive to noise, so you might try to see, oh, what's that? It's like someone trying to do some harm to me.
Yes.
So that's hypervigilance. That's one of the symptoms. Then another symptom is nightmares. You might get loads of nightmares of the event, or actually something else as well, perhaps not related to the actual event, but you do get nightmares. Then the other symptom also is flashbacks. So it's like, what is a flashback? It's like reliving the actual event. Obviously, these are the triad symptoms of PTSD, but you might get symptoms related to depression, low mood, lack of sleep, lack of concentration, lack of energy, fear, general anxiety. So what the person needs to address the symptoms, and if we do talk about PTSD, then we might to start with medications like antidepressants, and also CBT. There is also trauma-focused CBT, trauma-focused cognitive behavioral therapy.
Yes. The patients who haven't been helped, and patients who present and actually come and say, recognize that what they actually went through has affected much of their life. So I'm talking about somebody who comes to 20 years maybe later, we've heard a lot of these cases who've surfaced 20 years later. Where do they start to come to terms with what actually happened and the terrible media persecution that they're inevitably subject to?
I think it's an important thing to see as well. When I was working in London in an area called Stoke Newington, there were a lot of Kurdish people living there, and there were majority of these Kurdish people, they were tortured in prisons in Turkey.
Yes.
So they were experiencing loads of PTSD symptoms for like decades, and some of them they didn't reach help for a long time. They didn't know that they had to go to see a psychiatrist. They could get some help. So they haven't dealt with these symptoms for time. Some of these symptoms subsided and they were not as bad as they were like 10 or 20 years ago, but they could still present with loads of these symptoms. So it becomes more part of your personality if it persists so far, in terms of like it's part of you now. PTSD is like part of you. So day in, day out, you're experiencing these symptoms. So if
that must be awful to live with.
It is awful.
Very stressful.
You might not have a social life because of that. You might be very isolated. You might look or be like chronically depressed in a way. So it's never too late to seek help. But if you have left these symptoms for so long, obviously they will be much harder to treat. So the ways for treatment, as we know today, is, as I said earlier, is antidepressants, sometimes combined with antipsychotics. And because some of these symptoms, they can look very psychotic, it's not psychotic in the sense of psychotic illness. It's like they might say to you, I can hear them talking, I can hear them shouting, we're going to beat you up, we're going to rape you. Like is what I said earlier, reliving the actual event. That's the actual flashback. But they need to get help. Obviously, the media will have a role to, in terms of bringing awareness of what is actual PTSD, how we can help people with PTSD, and provide them with the means to survive through that. I'm actually talking about surviving through this, because it's not easy to survive. Some people might commit suicide because, as you have said earlier, it could be unbearable, this kind of symptoms. It could be worse.
I wasn't speaking so much of the media in such a positive light, but I think, in fact, the opposite, a sort of persecution of somebody who's had the courage to come out and say, well, this happened. Well, how did it happen? Maybe you asked for it. How do we know that it's even true? Many of the cases now, for example, with the Metropolitan Opera, with the conductor James Levine, where these cases have been brought forward, and one says, well, how does one prove that these women were subject to wrong, I don't know, I don't want to say, well, they were raped, because it's still under investigation, and multiple court cases. The gymnasts, for example, in America, from the American gymnastics team.
I think it's a very difficult task, and there is no straightforward answer to this. Obviously, the media need to be controlled as well. Sometimes you feel that the media, no one is able to control the media in the sense of what's right, what's wrong, what's moral, and what's not moral.
Yes, that's a very valid point.
Because it's very subjective.
And ethics. Yes,
it's very subjective sometimes. And I think recently, with data protection that has been passed within the European Union, people which might be much more protected in terms of coming out, and their names and their lives are in much more protected way. So I think this could enhance people to talk about their issues, and knowing that if these things will reach the media, they will have the right to sue the channels or the medias that they bring actually these things out, because are very personal, and they could actually cause 10 times bigger harm to the person without having the media there.
To be completely objective, what about the person who's being accused before a trial
That's
has
right.
actually happened, because the stigma attached to the so-called perpetrator, and we've had cases of this as well, that have gone on to court and have found the person to be not guilty, and there was no repercussion, and I know of cases where the person actually committed suicide from the stigma of being chased, and they were never able to revert back to their jobs or to continue.
Yeah, and you should be actually guilty. If you are not guilty, then obviously you have the right to a fair trial. And if you don't get a fair trial and you get a trial kind of like customized by the media, your whole life has been ruined basically. And we have seen recently the event in Cyprus with the 2 doctors as well, that their names and everything was out, and how they were criticized by different people in the media. And it's very hard for these people to carry on with their lives. And if they are found non guilty, for example, in the court of law, how could they continue with their practice? And it's not just about your professional life. It's all about to do with your personal life, your emotional state, your physical health. And it's very hard not to get anxiety and depression or PTSD going through these procedures. It reminds me of a consultant psychiatrist, which they have made a movie about him, and he was my supervisor when I was training in London. You can Google him, Saskia, if you want. It's an interesting story.
Yes.
I can tell you the story if we had time.
Yes, yes.
His name is Jan Falkowski.
Yes.
Born in London by Polish psychiatrist. And one of his patients actually accused him for rape. And he was suspended, and he was investigated. He went to Crown Court.
Wow.
And what she has done, this potentially victim, which was not victim at the end of the day,
Yes.
and I think the Court of Justice did its work very well. She did, and got some of the condoms which were used from his dustbin, which was outside from his house. And she used basically his semen, and she went with DNA test, and DNA test was found on her. So it was a very hard case.
Wow.
And there is an interesting cherry on the cake, how he managed to survive through that.
Yes.
There was a third person's DNA there as well.
Good heavens. Absolutely flabbergasted.
And he was a director of mental health hospital recently, and he's working, and he's also in the Royal College of Psychiatrists UK. And they have made
She was prosecuted.
Yeah, she went to jail. But it's hard to survive through these events, and you have to be quite tough and get the right support at the right time.
I think that's very important, actually, that you've highlighted such an event, because there has to be balance. While under no circumstances are we condoning any sort of rape or conflict or violence, there are these cases that one must be aware and careful of. How careful do we have to be in protecting our teenagers, and especially those who are now 17, 18, hormones are raging, don't know really 100% what they're doing, and drink under the influence of alcohol
and drugs.
Many things happen. What sort of protection can one give? And we also hear of cases where girls simply have been drugged and have no recollection whatsoever of what happened.
I think that's a very important task for prevention here. We need to think about prevention and how can we use prevention to educate the teenagers. And this has been discussed in Cyprus and in different countries about education around sex in schools. And some people talk about going back to like primary schools to educate
It
children.
does seem to be getting worse and worse, in fact, than
people
earlier.
start having sex like from the age of 12 or 15. So I think if you go to high school or secondary school, that would be too late. So you need to even go back to like primary school and start with the basics, educate what comes with sex. Sex obviously is enjoyable for everyone, but we need to think about taking any repercussions that they might develop. So we need to think about different sexually transmitted diseases as well, HIV, hepatitis B, C, etc. And also we need to think about, for example, unwanted pregnancies, and how important it is to have sex if you are 12 or 16 or 18 or 20. Parents need to be there and educate their children as well.
I was going to say, is this a job of parents, or it's of the teachers, or it's a combined affair?
Yeah, I think it's the last thing you have said, Saskia. It's everything, basically. It should be a multidimensional approach. So we need to think about parents. Sex should not be a taboo anymore. We need to think that this is like food and water. So we need to think that it's a basic need, it's a basic human need, and obviously going through hormonal changes, the sex drive might increase, and you might not know how to react and how to kind of like control this. And on the other hand, you might have the church as well and telling you have to get married and to have sex, which makes things even more complicated.
Well, yes. We won't, oh, I didn't even think, we won't go down that route, because I don't know how prevalent that is. But how to discuss, to help parents to educate their, especially daughters. What do you suggest when maybe the relationship is not extremely close?
That's a very difficult task again. I think what's important here is also the mother-daughter relationship.
Yes.
And if there is no good relation between the two, then it's going to be very tough. It's going to be very tough for the daughter, it's going to be very tough for the mother. And obviously the daughter might try to seek support and help and learning from its peers, which sometimes could be good, but sometimes could be really bad, especially if your peers are already doing things that they were not supposed to, like doing drugs and alcohol and partying in a way that you can put yourself at risk. So I think that the mother has a role of approaching the daughter and trying to explain that your body, not just your body, but your physical and mental health is going through changes. So you need to understand what's going on. You need to understand that sex drive will just arise slowly but surely. So you might need to know what you're going to do with that. You're going to try and start having sex when you're 16. When do you actually feel ready to start having sex or experimenting with your body in a way that you learn about sex? So I think everyone has a role, and especially same-sex, let's say, parents, in terms of like with their children, with their respective children, meaning.
Yes.
So the father might be able to try and help the son, and the mother might try to help the daughter. It might be more difficult, like the father trying to educate the daughter in terms of the sex, and there might be some more taboo there, and how to try and educate in that perspective.
Sons being taught to have respect, is it feasible? Somehow, I've also heard parents say, my son is exactly like this and like this, and the teachers have actually called them. There was a recent case at a school that I know of, and the parent was called in to see how their son is actually behaving. Incognito, she was told to keep away, and she said, I cannot believe that my son is behaving in such a way. I'm absolutely appalled.
Yeah.
How much of a differentiation is there between the home and the time that sons go out and they have to behave in a certain way, in inverted commas?
Honestly, children are like copycats to their parents and to their peers. What they see, they do. There are quite a few nice videos on YouTube you can watch, and you can see that their children are actually doing what their parents are doing, like littering the, let's say, the countryside or the different streets with bottles of water or bottles of Coke, etc. This is to do with everything. If they see violence at home, they will be violent at school. So it's very hard for me to believe if they were not violent or aggressive at home,
Yes.
and they were the like chickens at home, then suddenly they became the tigers in school. I think this is very hard to believe.
All right.
Unless there is such a strict ground at home, and the children are so suppressed at home, and they cannot do anything at home.
They feel the need to...
They feel the need, because they kind of like exacerbate need, perhaps, to get the anger out that they're not able to demonstrate towards their parents, so they start demonstrating anger towards their peers or in the classroom. So in psychological terms, sometimes we call this displacement, which is a defense mechanism.
Yeah.
Unconscious one. We don't have control over it. So we're trying to displace the behavior, the anger we want to demonstrate towards our parents because they are suppressing us, and we start demonstrating towards someone who cannot actually do anything against us.
We have to, of course, emphasize that rape is an act of violence.
Of course, and we have to take that into consideration, that it's not just sexual, as Mr. Gutierrez said as well. It's also a form of physical and emotional violence, because it comes as a group of abuse, basically. There is no rape without emotional and physical abuse. So it's all together. It's like a pack. If you've been raped, you're suffering through physical, emotional, and sexual abuse.
If you've been physically beaten but not raped, is there any difference?
Obviously,
is somehow the rape just the ultimate destruction?
I think you're right that it's the ultimatum, I think, the rape, because it's the ultimate form of violence that someone is basically taking control of your body and your sexuality as well. It's a trauma that subsequently might traumatize you in the way that you might never in your life being able to enjoy sex again, because you might even consider your own husband unconsciously or consciously as a perpetrator.
Yes. How do you help such a patient when you say that maybe that's an affliction that they're going to have for the rest of their lives? Do you just help to deal with it? Where do you start?
So I think they will need a lot of psychotherapy. And it's not like psychotherapy which is going to happen overnight and you're going to be fine next day. It might take 6 months, might take 6 years. So it's a long-term psychotherapy that you will need to address and learn how to deal with sex again. You might experience rape in your 30s and your life might be changed forever. You might experience in a rape in your early 20s when your sexuality starts to grow, and it's going to have a different impact on you. So it depends on what age you experience rape as well. What's important is you need to understand that it's not like all men are like the rapist that has done this to you. You need to be able to separate the person who loves you from the perpetrator who has raped you in the past, which is not an easy task, because there is so-called projection. So, and you're projecting onto someone else sometimes what you're thinking. And you're identifying your husband as a perpetrator.
Yes.
And I know lots of my patients that they tell me, I actually say to my partner or husband, let's take it easy. Let's start slowly. Let's have sex slowly, even penetration. Let's take it easy. So they might not be ready for penetration for a long time after rape, which is very important to take someone's perspective and ideas, how they feel, into consideration. And obviously the partner or the husband should not push it at the other end.
I was going to say that's not easy for the partner. It's as if you need to deal with both people.
Yeah, you need to deal with both people, and you need to do sometimes couple therapy to try and explain what are the consequences of this rape and how you should be able to deal with it. You need to give space to the victim to address the needs and to address the emotional state they're going through. They might have also subsequent event not be able to have children. They might be damaged internally, and they might not be able to carry children. So that's another potential trauma that will come after a rape. So you might need to be able to address that issue as well, not to be able to be a mother. So that's not an easy thing to deal with.
No.
So it's very multidimensional again, and you need to take into considerations everyone's views, and one victim from the next is not the same. Individuality needs to be addressed, and need to address the person's needs. So that's very important.
What happens in the horrendous situation of children being raped and having to have children themselves, children having children, 12-year-olds?
That's where the social services need to step in and help these people, because they will need to start therapy early and need to be able to address their own needs as well, and they're going to become mothers and their children themselves, and that's a very difficult task here again.
Should that even be allowed to happen? We hear of cases in India now where we've got 12-year-olds, 10-year-olds having babies.
There is no right or wrong answer to that. The different perspectives and their different views on the matter, perhaps from the community, in terms of the scientific community, in terms of the cultural community, in terms of the religious communities, etc. What's important here is, again, to take into consideration everyone's view. So that's to do with parents, family, because obviously they're underage, and you need to take parents' consent into what you're about to do. Take into consideration what's the legal system of the country.
Yes.
If, for example, abortion is allowed or not, could be a criminal offense. The law obviously needs to change in these cases. Like in Cyprus, we have recently changed that in terms of the abortion.
Yes.
So I think what's important here is taking everyone's views into consideration, and you should try to educate the 12-year-old as well as the family, because they're dealing with something they have never dealt in their lives.
You're speaking about things from a perspective where people are actually able to afford and get help. What happens in this situation? And I think that unfortunately there are quite a lot of people who cannot afford psychiatric help, or there isn't a psychiatrist who actually has the empathy and whom you could actually speak to, because there is, of course, that need for the psychiatrist, not, for you, you're not just another number, patient number 456, but you actually have some kind of understanding and empathy.
Empathy is very important, and empathy is something that you learn during your studies, but for some people it's very hard to learn, to say the truth. And it has to do with your personality as well.
Doesn't always come out.
When you go through the College of Psychiatrists exams for the UK and you do the practical bits, empathy is number one that you get assessed. And if you fail empathy, you fail the station. So it's a very important task for a psychiatrist to show empathy.
Right.
And not to confuse in English the word empathy with sympathy, because it's very different in Greek language and English when you compare the two. You should never show a pity towards your parents, and that's sympathy.
Yes.
You should be able to step into someone else's shoes, and that's empathy.
Yes.
And not to show sympathy, like manamu re in the Greek language.
Yes, I was going to say. Okay. Yes.
So I think what's important is to show empathy and have the right amount of time to assess and review your patients. Like, this is something to say about the national health system in Cyprus. If that will happen, hopefully soon, the psychiatrist should be given the right amount of time for helping the patients, obviously, and get paid for the right amount of money for helping their patients. So what's important here is, in European countries, we do have the health systems in place that patients can see psychiatrists. Obviously, in some places it's better, sometimes in some places it's worse. But when we talk about Africa or Asia, then you're absolutely right, Saskia. Things are out of control. Like in countries like Congo, which they've been named the capital cities of rape, finding a psychiatrist is probably the toughest thing in the world. Not able, even if you have the money to pay, you might not be able to find a psychiatrist.
Iraq,
and
Gaza.
There are many countries that they don't
many?
have trained psychiatrists. And you get like the different shamans and trying to help the people with being victims of rape without having the right training. So fortunately for us in the developing world or the developed world, we do have psychiatrists. Not as many as we need, but at least we have some. And in the public health sector, there are also psychiatrists. They can try and help patients with their difficulties. But for the countries of third world countries, unfortunately, the things are out of control, and that's where the United Nations again need to try and support these countries financially, with the staff, and there is always a room of improvement. I think there is always room for improvement from everyone, from states and also from the United Nations.
In Cyprus, are the statistics very bad?
So
in comparison with per head capital, in comparison with the rest of Europe?
It's not as bad as the rest of Europe.
I'm referring not to violence, but to rape.
Yeah, I think from what I was reviewing yesterday in terms of who's got the top one of rapes in the Europe is actually England and Wales, and Sweden follows. So that's where we talk about, like in UK, they were in 2015 there were 80,000 victims of rape.
That's absolutely appalling to hear the numbers.
That's really bad. The numbers are huge, and some other numbers like in states, they're like every 98 seconds someone is being sexually assaulted. That's actually, when we look at it's 1 in 6 women sometimes being a victim of sexual violence in the United States, which is a huge number. And statistics are 90% are obviously women and 10% are men. We still get men being sexually abused.
Yes.
And I don't know if you've read in the news in the last few years talking about men being raped in African countries, because they do take their semen and they use it for different kind of rituals. And
yes.
They think it's important to do that. Some prostitutes basically get paid for semen. In Cyprus, I've got some statistics from the Association for the Prevention and Handling of Violence. In 2017, there were 1,680 cases, which 548 were new cases. 1,680
cases
in general of domestic violence. Domestic violence. I will tell you the percentage of sexual violence in that as well. 215, they actually asked for a shelter. So 1/8 of the victims, they wanted to escape, they wanted to run away from their house. And 172 were victims of underage. So you've mentioned earlier about children, and we do get victims underage as well. So in terms of percentage of the victims, 89%, as I said earlier, were women. 2% actually were pregnant women.
Being assaulted. Sexually assaulted.
No, being assaulted in general. We don't have the exact statistics of pregnant women being sexually assaulted. But we can see that 30% was emotional abuse, 54% was emotional and physical abuse, 11% was emotional, physical, and sexual violence. So we've got basically 11%, 1/10 of the 1,680, so that's 168 cases of sexual violence in Cyprus last year. So around 170 people, basically. And also
we could definitely do with reducing that.
Yeah, definitely.
And those are the reported cases, we have to emphasize. Maybe there are other cases that haven't been reported. Is that possible?
Of course. And as we have mentioned earlier, and there was people tend to try and hide away from what's happening at home, because we're talking about violence at home basically at this moment. and we can see the numbers rising. That's another thing to mention. As you said, we need to do better, but we're actually getting worse, because we're looking at 2016, and there were 1,160 cases.
Wow, so that was quite a
We've
large
got
escalation.
500 more cases within a year. So the numbers are rising. So we're not doing better for the time being. So
Maybe it's the case of actually more cases being reported, which is why we see a rise in
that's a good point as well.
cases.
Educating. People can call up and ask for help.
I was going to say, do
There's
you have a number?
There's a 4-digit number. I think it's 1440, if I'm not mistaken. 1440.
It seems
That's the
to
number
be
they
the right
can
number.
call
1440, so that you can call and
for help.
Report and
we've got
get
some
help.
statistics as well. I'm not sure if you're interested in terms of the perpetrators. 15% have problems with alcohol. So 7% they have problems with gambling. 14% have problems with drugs, and around 20% they have affairs. The perpetrators of the domestic violence. So 1/5 of them have also other relationships, basically.
That's also very difficult to have to deal with.
Yeah, as well. And
How many of the cases have actually been prosecuted?
I think a very small amount. It's not reported on this data I have here.
We can have a look into that possibly another time.
Yeah, but it's a small percentage of actually not just being taken to court, but even convicted, if we're going to try. And sometimes the victim is also pressurized to drop the charges. And I think that's where the state needs to step in and try to take that into court and not to drop the charges. They're going to say, oh, your wife is dropping charges, we're not going to deal with that anymore. That's where the police here needs to, even if basically the witness, the main witness is the victim and has given its statement, that statement has been signed by the victim. It can still continue to the criminal justice system. Obviously, they might not have the same chances of being convicted, but the police needs to pursue, I think.
Difficult subject to discuss. Thank you very much for your openness and frankness. Once again, Dr. Mikellides, it's a pleasure to have you in the studio.
All right. Thank you very much, Saskia.